Hello. Hello. All right, so I'll go ahead and get started and people can catch up with us. Hello. Nice to see you guys. All right, we'll go ahead and get started. So real quick, my name is Brooke. I am the nurse practitioner at Port St. Lucie Medical Wellness. I have my doctorate in family practice, and I've been doing aesthetics for about 5 years now. I recently just opened the Port St. Lucie Medical Wellness, I would say like towards the end of May, beginning of June. And okay, Leah, I'll answer that in a minute. And we do monthly specials and we have like prizes and giveaways and stuff like that all the time. So when you come in, usually you'll see those like posted or we'll talk to you about them. So this month we have for new patients the Dysport, which is a neurotoxin similar to Botox. It kicks in a little sooner and can last a little longer. Hello, Kara. For some people, it's good for people with a higher metabolism, or some of these girls and guys work out a lot. If they're doing physique or bodybuilding, they are spending hours in the gym, and the Dysport tends to withstand that a little bit better. Hey, Jessica. And then the Botox. So we have a Dysport special. It's $4 a unit up to 60 units. So it sounds like a lot of units, but Dysport is, I've got to use 2 to 2.5 times more to get the same effect for the same amount of time as when I use Botox. So for instance, a lot of times right here, a common dose for Botox is about 15 units, and that would be about 30 to 50 in Dysport. So that's why you see such a big swing in how many units we use, and that's why there's such a big price difference, because they're compensating for that price. Botox is Botox, everybody knows. So we have a special for that right now, is 20 units for $179 for new patients. So if you guys are due for your treatments, now is a good time to do it. If you're not due yet and you're a new patient, you can call and pre-purchase that package, and when you're ready, it'll be there for you to use, and you'll still be able to lock in that discounted rate. Our other specials for this month, we are doing a model call for microneedling with radio frequency. So this is a treatment. It's got a bunch of little tiny gold-plated needles that are hollow, and it's in like a gun. It's not loud or anything like that, but we do numb you up. But it kind of just creates micro trauma to the skin, which in essence recruits your inflammatory system to rebuild and strengthen that tissue. So during the course of that, it rebuilds collagen and elastin. The radio frequency is a frequency that is delivered through the needles while it is inside the skin. So even though it just happens for a split second, that kind of punch of the needles, that radio frequency is being delivered through those needles. So we are able to kind of treat deeper into the dermis to stimulate collagen production deep under the dermis. So that right now we're doing a model call. So that means if you are wanting to do this special, we would take before and after photographs and post those on our website and on our social media. So that would be something you'd have to be open to. So we do a package of 3. You do 1 treatment a month for 3 months. And regularly that's $2,100. And for the special, if you allow us to do the model part where we take your pictures, that's $891. So that's a great savings. And it's not only for the face, so you can use it for the neck to help like tighten the skin up in the neck. We've got some people who are doing it for the stomach, kind of that excess skin you get after losing weight or after you have a baby. I think this one froze. Something froze. Hey. Is it back yet? Maybe it just looks frozen. Okay, my Instagram might be frozen. Anyways, using it for skin tightening for just kind of the excess skin that can be left over after losing weight or having babies. And our second special is for IV therapy. So usually that can range anywhere from $100 up to $300 for IV treatment, depending on what kind of cocktail we make of that. So we'll make, just depending on your needs, I'll kind of just sit down with you and talk to you about, what are you looking for with this IV therapy? Are you looking to be healthier, like an immunity boost? Yeah, Susanna said she loves IV therapy. Yeah, it does help a lot. So I can do it for immunity. I can do it for like skin and soft tissue. So I have some ingredients that are great for that. Vitamin C is great for that. Glutathione is great for that. So we'll just sit down and talk and kind of make your cocktail based upon what you're looking for, what kind of benefits you're looking for. Additionally to that, you could add peptides. So I do offer probably about 12 different peptides. Again, depending on what you're looking for, we can kind of look through those. If that's something you wanted to add into your IV service, you could absolutely add that in as well. And those will help anything from anti-aging to burning more fat and maintaining your muscle mass, increasing your growth hormone naturally by stimulating the pituitary, just stuff like that. So there's a lot that help with things. Some help you sleep, et cetera, et cetera. It goes on. So we have 2 treatments only for $137. And that counts anything that we mix in with it other than the peptides. And then we have our last call before summer for our laser treatments. So we have IPL photofacial that kind of requires you to be out of the sun for 2 weeks before and 2 weeks after, just to get the best results. So the IPL photofacial is a laser that she kind of glides across your skin. It will pick up hyperpigmentation spots. So like those little dark spots we can get, we do people's back of the hands, we can do your arms, those little dark pigment spots that you get as we age. If we're lucky enough to age, we get them. Yes, it's in, Susanna asked, is it an impulse light? Yes, so it's, IPL is intense pulse light. It kind of zaps those little areas, and the laser is very sensitive, so it even picks up on ones that you can't even really see with the naked eye. And what happens is, when it picks that pigment up, it kind of locks in on it and zaps it. And then after a couple days, the next couple days, they'll get very dark. You almost look like you have like black freckles. They get very dark, and then about, my live is not working over here. And then about 4 days later, they all start kind of falling off, and then your skin is all left really pretty one tone. It's really pretty. If you've never done it before, it really just changes your whole skin on your face, the way you look, and the glowiness, and just getting rid of those dark pigmented spots. So that one is regularly $350, and right now we can do the special for $97. Again, that's something that's recommended for 3 months, 1 treatment a month for 3 months. And after that, it will kind of just depend on your lifestyle. So if you are in the sunlight a lot, you're out in the heat a lot, um, and you're not wearing sunscreen, those spots will come back. So then just based upon your lifestyle will dictate when you need to repeat that treatment. So those are kind of some of the specials we have going on. Again, we have the membership, which is $129 a month. You get several different things that you can pick from that are complimentary. And even though we have it like listed what's complimentary, I'm more than happy to sit down with you and talk about your goals. And if there are other treatments that aren't included in that, is something you are going to want to do every month, I'll be happy to sit down and talk that out with you, and we can, alter those based upon your needs and what you're looking for. So that's $129 a month, and then you get those certain services for free, like a IPL photofacial is included in the 129, and or you can get an IV, or you can get, I think it's a peel. So one of those is included complimentary, or we can change it depending on what you're looking for. And then you get a free B12 shot a month, and you will also get 15% off all other products and services. So even some things that aren't listed on there, you'll get 15% off. Excuse me. And then you get the Botox, Dysport, Xeomin, and fillers at a like way reduced rate, as opposed to people who aren't members. If you don't use that free service, that for 1 month, that $129 isn't completely lost. So some places you'll pay that $129 a month, and if you don't use it, that money is gone. You don't get to use it for something else. I don't do that. I bank it for you, and if you haven't been in a couple months, every month that 129 is going on there. And when you come back, you can use it as credit for another service that you're wanting to do. So you won't lose that money. I think that's all I've got for you today. So the last thing we have is, over the month of February, we were doing a raffle with Alastin product line. And I'll kind of just briefly go over that up here for you. So the Alastin product line is something that they use. I'm sorry, I don't know what's wrong with it. Everybody's saying it keeps going in and out. My other Instagram live just ended, so I don't know what's going on. But the Alastin product line is something that prides itself on the science of rebuilding the skin in the deep dermis. So other areas or other skin products kind of sit on the surface, or maybe go down 1 layer or so. This one's going down 3 layers into the dermis. Oh, sorry, Kara. Kara said she forgot about the raffle. So this is kind of just some illustrations of that and how it works. So this helps promote cell turnover. So you get rid of like the cells that should be dying that aren't dying. As we age, the cell is called apoptosis, when the cell has a pre-programmed death. But a lot of times it doesn't die when it's supposed to die, and then you have these useless cells that aren't doing what they're supposed to be doing. So the elastin helps those cells realize that they should die, and then the new cells that are rebuilt are healthier. It increases that cellular turnover on the skin. It helps with the hyperpigmentation and the fine lines and skin elasticity. So that's why it's called elastin, because of the elasticity part. So these are just some diagrams that show kind of how it works. So the products that I have that are in the raffle basket, the first one is the Alastin lightweight, ultra lightweight moisturizer. So it's very light. You can't really feel it on your skin, so it's good if you've got oily or combination skin. And it helps hydrate the skin, and then it soothes and calms irritated skin. So if you've got rosacea, anything like that, it helps. Helps support the production of new healthy elastin and collagen with that tripeptide and hexpeptide that they have specifically in their products. So that's the first product that is free in there. The second one we've got is the Alastin Ultra Calm Cleansing Cream. And I didn't mean for it to go that big. Let's see. I just want it halfway. Okay, I guess it doesn't care. Oh, there we go. So this is just an ultralight cleanser that won't destroy the pH balance of your skin. It helps promote hydration, keeps that moisture balance in the skin, and while cleansing the skin. So it helps with irritation. It's good for post-treatment things, so like the microneedling or hydrodermabrasion or dermaplane. It's good to kind of calm that skin down. So that's another product that's in there. The other product is the hyaluronic acid, which is used for moisture. So it's good for dehydrated, dull skin. Also good for post-procedure. Many of their products are linked to procedures. So when you come in and you have something done, oftentimes there's a product that is specifically made for recovery for that. And then the last one I have that I can't find, let's see. Oh, here it is the eye cream. This one I love. I love the eye cream. So this one is going to help with fine lines and wrinkles around the eyes. You use it twice a day. Also help with puffiness and the dark circles under the eyes. So this one's great. Use it twice a day. I've been using it for I guess a couple months now. I love it. It's super hard for me to find an eye cream that I love, and this one kind of checks all the boxes for me. So all four of those products are in this gift basket, and they in totality are worth over $500. So it's a pretty big savings you're getting with these products. We carry numerous other products that are in the same Alastin family. The hydrating tinted moisturizer. If you're not wearing a sunscreen, this one has sunscreen in it. It's a tinted sunscreen moisturizer. It's good for combination skin. Like for instance, I have a tendency to break out really easily. I can use this and I'm not like a grease ball by the end of the day. And it's usually what I use as my foundation, because I find that foundation, as I'm maturing, is heavier on my skin and really settles into some of these fine lines and stuff. So this one's really nice and lightweight, and it doesn't leave me super greasy. And then we have a vitamin C serum and then a couple other ones. So you get the gist. So what we're going to do now, I have my little raffle box here with everybody's cards, and I'm going to pick somebody. You want to pick? My son is going to pick somebody. Come over here because it doesn't reach. Wait, let's do it so they can see, so they know we're not cheating. Okay, go ahead.
Okay.
You mixing them up?
Yeah.
Who is it?
You don't.
Oh, Doreen! Doreen, she goes by Reenie. She's adorable. So, she's the winner. Yay, Doreen! She's a cute little lady. I would be happy if anybody had won. You guys are all cute. I have some really awesome patients. So, Doreen, I will contact her tomorrow and she can come pick up her basket. Somebody on my Instagram asked, what is the difference between, what did she ask? The difference between, I think, Sculptra and Radius. Let's see. Let me see if I can look it up. I think she said Sculptra and Radius. So both are similar in that they can be used as biostimulatory. So these are injectables. Radius can be utilized as a filler, and Sculptra is not utilized as a filler, but both help promote collagen production. Sculptra is in the classification of fillers, but it's not a filler. It's going to stimulate your body to make its own collagen, and typically we do 2 or 3 treatments with that. We do, 1 vial for each side of the face. I know. Congrats, Rainey. Oh, Michelle. Um, so we do 1 vial for each side of the face, and the standard is 1 vial for each decade of life you are past 30. So if you are 40, then we do 1 vial. If you're 50, we do 2, that kind of stuff. Typically, even if you're 40, I'll do 2, 1 for each side of the face. That's when you're gonna really see the most benefit. And then we wait about 6 weeks and we look at you and we see how you're coming along. If you're not quite where you want to be, you think you want a little bit more volume, then we'll do another vial. And then every year you'll have a Sculptra birthday. So that first time that you did Sculptra will be your anniversary date, and you will do another vial or 2 on that day to kind of maintain the results. It's very pretty. It's very natural. Um, your body is not going to overbuild collagen. Like, if you get filler, you can put too much right here, or you can put too much here. Your body is not going to create like these weird boluses of collagen. It's very smooth, and we do it all throughout the cheek, in here, and all up the cheek. Some people will do the temples, like we start getting a little hollow right here. Um, I would say I did 2 vials in January, and I started noticing the effects 3 weeks later. Like 3 weeks later, when I was putting on my blush and I kind of smile like that, I noticed, oh, my cheeks are back. So I've always had like big cheeks, and now they were getting really like lost. So I do have a little bit of cheek volume from that. And that was about 3 week at the 3 week mark that I noticed that. So January will be my sculptor birthday. Likely I will do another couple vials before then, just to kind of build things back up, particularly in here. Um, but I love Sculptra. It's great. The Radius is also a similar formulation. It's a PLLA, so this is a polyl lactic acid. Both of them are. Um, Radius is more dense, so that's why it can be utilized as a filler. So, or I can dilute it down, and basically what I do is I'll take like a 10 ml syringe and 5 mLs of normal saline, and I'll mix the Radius in there to kind of like hyper dilute it and thin it out. Because when it's utilized as a filler, it's very thick. So it's a filler I would use to like build bone structure for somebody. So if I was like building a jawline or building a chin or even the nose, Radius is a good choice because it's very firm. It's going to stay right where I put it, and it's going to hold that structure. But when I thin it out like that, it's good for just collagen production. So you can utilize it as that too. Um, the utilizing Radius as a filler has its pluses, right? Because you're going to get more benefits longer term because it's going to help promote collagen production. However, as a filler, other fillers are hyaluronic acid base, which are reversible with a product enzyme that we call hyaluronidase. The PLLA is not reversible. So once it's in there, it's in there. And if you get God help us if you do, but hopefully not, you get a vascular occlusion, which is when that filler will block an artery or blood vessel. It's not reversible. So we have to just flush the area with a bunch of saline. We can use hyaluronidase, but that's been shown not to be effective scientifically. But we can try and flush the area with a bunch of saline to kind of break it up. But it's a little bit more difficult to manage in that respect. It has its place for sure, but just kind of be aware of that if you're using it as a filler, that it does kind of have that downside with it. If you're with a qualified, experienced injector, that's not going to be an issue because we mitigate those risks. So, we are getting the needle right where we want it, and we're aspirating to make sure we're not in a blood vessel. We've studied the anatomy for 10 freaking years, so we should know where everything's at. Obviously, there's variations in anatomy between people, but we do things to mitigate that risk. So you can use either one. If somebody were to say, come in and say, do whichever one you want on me, I would pick Sculptra just because it's more of a natural look with the less potential for complications, if that makes sense. So Kara asked, what one is where you draw blood to use? So that's PRP. I say PRP, but excuse me, I actually use PRF. So PRP is platelet-rich plasma. PRF is platelet-rich fibrin. So they're just prepared differently. So I spin both of them down to get the red blood cells out. I draw your blood and we put it in the little test tube vials and I spin them to get those red blood cells out. PRP, I spin it for faster for a longer period of time. So I get the red blood cells out, I get the white blood cells out, and all that's left is the plasma. And PRF, I spin it slower for a shorter amount of time. So there's still white blood cells in there, like leukocytes, fibrinogen, fibroblast, all those things are still in there. And overall, it will have a higher percentage of growth factor in it. So PRP has its place, like for the hair. Obviously, I'm not trying to build volume and collagen in the hair. So it's good for that if I'm doing, the vaginal restoration injection. We're not necessarily trying to build volume there. We're just trying to promote collagen, thicken the vaginal wall, and re-stimulate the glands, those kinds of things. So it's not really that effective there. PRF is good for joints. It's good for skin rejuvenation. It helps produce collagen and elastin. But I also use it for joint injections. It's great for joint injections. I've been having like awesome success with that. People are limping in and coming back a week later skipping. So it's been really good results with that. So hopefully that answers your question, Kara. Yeah, probably the PRF for you. Another thing I can do that I've coined the term for is biogel. So I write my first name with a B exclamation point. So the biogel is B exclamation point O gel. So that's just my twist on it, right? But what I do with that is I take the PRP or the PRF, and actually I have a little heater that I heat it up in, and it thickens the PRP or the PRF to a like filler consistency. So I can utilize that in the joint. Like if somebody's got arthritis, I can utilize that in the joint to give them a little bit of cushion. So oftentimes they're bone on bone with that joint. So I can give them a little bit more cushion with that. And then they also get the benefits of the PRF as far as inflammation reduction and all those things. So but I can utilize it as filler. So a lot of times when people are wanting like under eye filler, I usually will say, let's do PRP or PRF first, and I'll create your own filler out of your blood. And that gives you volume for a couple months. But while you're getting that volume, you are getting those stimulation of the growth factors and the elastin and the collagen. So you get more benefit out of it because that stimulates your own collagen and elastin for upwards of 18 months. So whereas the filler, you're just going to get the filler, it's going to dissipate or it's going to migrate. Hopefully it doesn't, but if people aren't doing it how they should be doing it, it has a potential to migrate. And the PRF just doesn't have those risks associated with it. It just takes time, right? We're asking our body to make its own. So it takes a little time. Some people don't want that. They want immediate results. They want to walk out looking like a new person. So filler is appropriate for them because the PRP is not going to do it. It's going to take 6 to 8 weeks, probably 2 treatments to get that similar effect. And some people just don't have the patience for that. All right. Any other questions? Comments? Concerns? Hi, Rachel. Let me double check here. I don't think anybody has any questions over here. Okay, so that's all I got for you guys. So come and see us. We are off of Port St. Lucie Boulevard, 702 Southwest Port St. Lucie Boulevard, between Gatlin and the Turnpike, right off of Port St. Lucie Boulevard and Del Rio. We're right next to that corner there. Or feel free to call us or text us at 772-207-0080, and I'll be happy to answer any of your questions, get you in for a free consultation, whatever you need, you can ask. So I will see you guys next Monday. Bye.